This program is brought to you in part through a grant from Integrative Therapeutics. When results matter, you've made the right choice with ITI. This program is brought to you in part by Emerson Ecologics, solutions for optimal patient health. The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. This week, the American Health Journal presents a special report, Discoveries in Alternative Medicine, with your host, Roger Cooper.
Hello and welcome to the American Health Journal special report on Discoveries in Alternative Medicine. I'm Roger Cooper. Our program today focuses on naturopathic physicians, doctors who were trained in the art and science of natural medicine. Although it almost disappeared in the mid-20th century because of the popularity of drugs and surgery, naturopathic medicine is making a comeback as a natural, vital part of the healthcare system. First up today, we'll look at the risk factors for cardiovascular disease. Then, reporter Laura Windsor talks with a doctor who offers a naturopathic treatment plan for preventing cardiovascular disease, and talks with another doctor who authored a cookbook for just the same purpose. Later, we'll look at the growing number of people in America who are diabetic. Plus, we'll look into the naturopathic treatment options and meet a patient who found the conventional approach to treating his diabetes just wasn't enough. Then we'll take a look at the overall philosophy of naturopathic medicine and the treatment of cardiovascular disease and diabetes. Statistics now show that 1 in 3 Americans develop some form of cardiovascular disease. Dr. Decker Weiss explains that there is more to it than genetics.
You know, Duke University and University of North Carolina studied the genetics related to heart disease. They really only found about 2-3% of those folks that got it really had genetic problems with it. It was more the chronic oxidation and inflammation and habits that led to the disease. So you don't get a normal explanation sometimes, because when you go a layer deeper, as naturopathic physicians do, you get to that balance where we do have repair mechanisms for vessels. And when they're unable to keep up, then you develop the syndrome. Cardiovascular disease is an imbalance and a repair mechanism. So the body nicks coronary arteries and the vascular system through the day and repairs it. When that mechanism, isn't working properly, then you get cardiovascular disease. Conventionally, what they're trying to do is interrupt the disease at either the cholesterol manufacturing process, or they're trying to interrupt the disease when it's 70 to 90% to 100% occluding a vessel. For naturopathic physicians, it's a very predictable disease. If you have chronic oxidation and inflammation in your body, you will develop the disease. When 1 in 3 Americans develop cardiovascular disease, you have to start to look at who isn't getting it. You know who isn't getting it? The people who don't have chronic oxidation, the people who don't have chronic inflammation, and the people who have good nutrient status. So as a naturopathic physician, with my patients, my goal isn't just heart disease. My goal is to get them to 85 and functional. So there, if I look at oxidation, inflammation, and this chronic mineral deficiencies that develop with these folks, and you reverse those issues, you don't have the problem. I've been practicing as a cardiologist for over 12 years. I've only had 1 patient have a heart attack, and they're doing just fine today. That's not by coincidence. That's by following the laws of physiology, which we know. The causes of heart disease are indisputable. Oxidation, chronic inflammation. How you treat those and identify those is very different.
When talking about clogged arteries, how much does it take to be considered dangerous?
When a patient has a 15% occlusion, if they can find it, because generally angiography and stress testing doesn't find it, but if you have a sensitive CTA test, for example, that finds a 15% blockage, this is dangerous. These are the ones that rupture and kill you. The 70, 80, 90% blockages can cause chronic chest pain, but they're not the ones that kill you, which leads to supportive statistics. Angioplasty, stenting, bypass surgery don't prolong life. They get rid of chest pain. They get rid of 80, 90% occlusions fast and furious. but those aren't the ones that generally kill you. This is in medical books. This is accepted. I taught cardiovascular disease to medical students for 7, 8 years. This is in the books. Those 15%ers are the high alert people. They need to be on things that make blood slippery. They need to get all that inflammation under control, not by just going on a statin medication or if at all, by looking to where the inflammation is. Inflammation is fuel to the fire. If you have a little bit of heart disease, throw in a bad digestive tract, throw in some joint pain, throw in some skin rashes or estrogen dominance, now you got a fire. Now you have a little spark going to a fire. Where the naturopathic physician can go is to where the inflammation is. Get the gut problems under control. Get inflammation out of the intestines. Digest your food properly. Get the skin rashes under control, not with steroids, because that's going to lead you to a later heart problem, but with the natural therapeutics that we're the experts in. Getting these chronic inflammatory things under control is huge. If we use ibuprofen for joints, we would expect there to be heart problems later, like the statistics tell you. If you use glucosamine, chondroitin, and homeopathy, and you detox their livers, and their joint pains get better, now we've got a heck of a system, and that's why we've been around 120 years.
Now with a report on preventing cardiovascular disease. Here's our reporter, Laura Windsor.
We talked about the causes of cardiovascular disease, but to find out if there is a way to prevent it, we talked to Dr. Lucy Rojo.
Well, one of the preventive things that people can do is basically start watching what they put in their mouth. Anytime a client or a patient comes to the office, we're going to look at their diet. Generally, that's a big piece of the picture. One of the other issues that comes up is that people just aren't exercising enough to get that weight managed and those blood sugar issues managed. So, you know, those two things in and of itself would go a long way to really help with cardiovascular prevention, cardiovascular disease prevention. The other factor that many people have control over is their smoking. Smoking is a huge cause of cardiovascular disease. And so people need to start being conscious about what they're doing with their health and really make a commitment to being preventive about possible disease factors that they may have in their family history. With exercise, generally what I recommend to my patients is at least 3 days a week, 40 minutes a day. Depending on the type of exercise you're doing, you could probably get more bang for your buck using one form of exercise versus another. One of the areas that I like to emphasize is resistance type of exercise, because muscle generally dictates metabolism. And so that would help you with managing your weight. It would also help with blood sugar management, which is something we've described before. So the recommendation that I generally make to my patients is 3 days a week for about 40 minutes. Do some sort of aerobic exercise to help with the circulatory system, but also some sort of weight resistance training that can also help build muscle so that you're controlling blood sugar. Dietarily speaking, I generally ask my patients to go ahead and have small frequent meals throughout the day so that their blood sugars again are being more managed than doing some of this movement. And I generally will ask them to start looking at the types of foods that they're eating. I ask them to go for low glycemic foods that don't alter their blood sugar levels so much. People are surprised about melons and oranges and things that are in the high glycemic that they're thinking are healthy, but they're actually not as healthy as one would think. So we ask them to look at eliminating their trans fatty acids in their diet, watching the high glycemic foods and eliminating those from their diet. Fruits and vegetables, preferably as raw as they can go, fresh organic, better than frozen or something in a box. So those are just some basic foundational things that many people aren't being attentive to by just choosing a boxed item or something that's, you know, from a fast food store. We generally don't recommend that people make the majority of their diet from a fast food or a boxed diet or processed foods. The other piece that we put into the diet, or that we recommend that people include in their diet, is complex carbohydrates, whole grains, minimizing the simple carbohydrates. Again, organic is probably an ideal way to go if people can get that source of food.
Getting someone to change their diet is not an easy task. For guidance, we went to naturopathic physician Damon Jones in Washington, D.C. She's the author of Delicious, Recipes for Vibrant Living.
When patients come into my office, the number one question that they have for me is, if you want me to change my diet to help me improve my overall health, What am I supposed to do? How am I supposed to eat? I ask them what kinds of flavors do they like? What kinds of foods do they like? After I give them some basic guidelines on how to eat. When we're talking about Americans in particular, the United States Surgeon General said that 70% of a lot of our chronic diseases could be prevented by behavior and lifestyle. And what I suggest to them is to look at whole foods as a great start, no matter what your health condition is or if you just want to be a more healthy person. And what that means is eating things most closely in their natural state. So for example, if you had nuts and seeds, you know that those grow on trees or on plants or on bushes, and that you can actually get an almond or a walnut or a cashew. Because, for example, there is no such thing as an Oreo or a marshmallow tree. So those things do not come in their natural state. So therefore, those things should be reduced or avoided. And so some suggestions that I have for people is look at how many servings of fruits and vegetables that you're eating a day. Okay, the recommendation is anywhere between 7 and 13 servings of fruits and vegetables a day. So are you having fruits for snacks? Are you eating fruit for dessert? Are you looking at greens and squash and, other vegetables other than broccoli and carrots? Just look at what you're doing right now and try to add one thing each month. So start to change around what you're eating. The reason I wrote my recipe book is because patients kept asking me, what can I do? How can I make it easy? How can I make it fast? And so I created recipes to help them with that. If you don't have access to that, then go to a vegetarian cookbook or go to a how to eat with fruits or fruit smoothies, or there are lots of different recipes on the internet. There are lots of different recipe books. There are lots of different recipe cooking shows that will give you ideas of how to start incorporating more fruits and vegetables in what you're eating now. And just by doing that, you will improve your health outcomes. And there may be more significant changes. It's a place to start, and everyone has to start somewhere.
Another bit of advice on selecting the proper food was to eat a rainbow every day. For Discoveries in Alternative Medicine, I'm Laura Windsor.
Another of the chronic debilitating diseases plaguing our nation is diabetes, with estimates of over 10% of our population affected. We talked with Dr. Beverly Yates, director of the Naturopathic Family Clinic in Mill Valley, California, to learn more.
The number of people who have diabetes in the U.S. right now is about 24 million and growing. It's estimated that about 25% of the population that has diabetes doesn't even know it. So if you include the people who still don't realize they have diabetes, it's really more like 32 million Americans have this problem. That's more than 10% of our population. It's substantial because it's an expensive disease. When you're talking about diabetes, there's two kinds. There's type 1 diabetes, which I think most people understand is the one where the pancreas no longer makes insulin. And that means then that the body's ability to deal with glucose, with blood sugar, is completely gone. And they clearly need medication, and they need to stay on their medication. Exercise and diet can help avoid serious complications, but for a type 1 diabetic, to avoid insulin is really not an option at this time. Now, type 2 diabetes is a different phenomenon. It means that the pancreas, a wonderful organ there in the gut, does indeed still make insulin, but the insulin they have isn't working quite so well. And there's degrees of not working so well. There's insulin resistance, where the insulin's kind of ineffective, to where it's pretty much useless, and a type 2 diabetic, unfortunately, sometimes winds up on insulin in order to control their diabetes. The good news is for type 2 diabetes that it can absolutely, completely, and credibly be solved with natural medicine approaches over a period of time. The keystones of that will absolutely have to be their complete cooperation around sane nutrition specific for that person. They're going to need to take some smart supplements and herbs. They will need to exercise in specific ways that include both an aerobic component as well as weightlifting. That will be their tickets to success if they want to be able to avoid having to take insulin and perhaps completely get rid of type 2 diabetes. In naturopathic medicine, when we're treating someone who has diabetes, whether it's type 1 or type 2, there's two paths we can go down. One is where we're working with a medical doctor, an allopathic practitioner, an osteopath, whomever it might be, which is a fine way to go. There are people who absolutely need both approaches. They're not ready to be independent from what conventional Western medicine has to offer. And in some people's cases, for their health, it wouldn't be a safe idea. It just wouldn't. Other people, particularly if they have type 2 diabetes, aren't ready to make that step. And if they are, though, they've got to cooperate. So this means then they can't decide to go rogue and have like a box of donuts. That's just not going to work. And believe it or not, there are people who do some silly things, and they know better, but they still do it. So in our case, for naturopathic medicine, what we're trying our very best to do is target the things that are awry and get them back into good order so that health can be restored. Believe it or not, for a lot of diabetics, the real issue is they are depleted of the nutrients they need in order for their blood sugar to be normal. That, coupled with lifestyle habits like the kind of foods they eat, the quality of food specifically that they eat, especially the fats and the carbos and the proteins and those details, along with the kinds of exercise, will almost all the time be a huge support. So let's say it's a type 1 diabetic and they're trying to perhaps use less insulin or have an easier experience when they take their insulin so they don't have big gaps in the day. For their energy management, they would be well served. And somebody who's a type 2 diabetic, again, it's all about personal responsibility here, who perhaps really wants to have a longer leash between insulin medication or wants to get off of those kinds of management programs or be free of it completely, would be well served. But here's a caution for everyone to know. This is a time when you want to see a licensed health professional. You want the real thing, a naturopathic physician. You don't want to just converse with someone at the health food store or some other purveyor of vitamins and supplements because you don't know what the heck they're going to tell you. And believe it or not, there's still people out there who will tell members of the public that a type 1 diabetic doesn't need insulin. And it's a crime because that's not true. That's absolutely not true. Now for type 2, we can talk about that, but for type 1, really, we're still not there yet. Maybe the next generation of medicine will free everybody from that need, but we just have to respect what's real. So if you really want the results, you need to go to the people who can get it for you.
I believe that not everybody can do this. I believe the person who chooses to see Dr. Yates or someone in her profession really has to want to take responsibility for their health. There's too many people today who are more than willing to let the doctors tell them what to do and they follow. You're not going to succeed with a doctor like Dr. Yates if you're going to sit and be told. She's an interactive physician. And if you can interact with her and share with her all that you experience, she will do the best for you.
And now a Discoveries in Alternative Medicine quick quiz. Which of the following can cause indigestion and heartburn? Coffee, large quantities of vegetables, lemon water, or eating small, frequent meals? Your answer next. You're watching the American Health Journal presents Discoveries in Alternative Medicine. Which of the following can cause indigestion and heartburn? Coffee stimulates the stomach to secrete hydrochloric acid and on an empty stomach can lead to possible heartburn and indigestion. While a diet high in vegetables supports optimal digestion, lemon water before a meal stimulates the stomach and intestines to secrete their digestive juices to help us digest, and small frequent meals decrease excessive stress on our digestive system.
To learn about the naturopathic approach to the treatment of diabetes, we talked with Dr. Lena Kian, but began by meeting her patient, Bill Green, who explains that conventional treatments only got him so far.
Well, about 2.5 years ago, I started feeling really fatigued, and my vision actually started getting quite a bit blurred. So I didn't know what was going on, and I went down to the local pharmacy, bought a test kit, a diabetes test kit, and my wife suggested I do that, so I tried that out, and it was really high. So went to my doctor, and they diagnosed me as type 2 diabetes. And after that, they put me on the medications, and it came down quite a bit and kept coming down, and it got to a plateau where it about stopped and wouldn't come down anymore. And the medications, I wasn't feeling too good and stuff with them, and I didn't want to increase them to bring it down where it should be. So we thought, well, let's try that. We've heard stuff about natural medicine, so we ended up going to her and having some good visits, and she put me on some medicines or some natural products. And actually the diabetes came down quite a bit more, and it's real close to the levels I want to get to without going to the medications from the doctor, increasing them. And overall I started feeling better, and the stuff I was taking from her, my energy levels went up, and I wasn't taking naps every day, and feeling a lot better, and I have been, and the points of the diabetes came down good too, so real happy on all that. I went in there, I was a little worried because on the door it was women's doctors on the door, so I was kind of nervous about it, and I went in there, and she was real easy to talk to, and real pleasant, and questions she answered everything. I was wondering the difference between two doctors. I've never been to a natural doctor before, so she answered everything to my satisfaction and above, so I'm real happy. The doctor I have is real good too, out of Loma Linda, so I'm real happy with him, but she was a bonus above that. It's something like icing on the cake, so I'm still taking my normal medication, but I didn't have to increase it all or anything. If anything, I've brought it down to level, and taken her natural stuff, I've stayed the same, so I'm real happy.
We asked Dr. Keon the importance of family history.
Just as important as it is to know your family history, it's also important to know that your lifestyle and your environment play just as significant, if anything more, of a role in determining the state of your health. So diabetes is a lifestyle imbalance. If you're abiding by eating a whole foods, low glycemic diet, if you're exercising and being physically active, if you're engaged and feeling very connected to your environment, then you're less likely to become diabetic.
I get up in the morning, and every day almost about 1 or 2 o'clock I'd want to take a nap, and now I go through the whole day no problem, and stand with her stuff that she prescribed to me, and real happy.
He feels great. He's lost weight. He feels, and that's what's interesting, is when you change your diet and you eat a whole foods-based diet, you want to keep doing that because it feels so good, and you can't imagine eating anything else. So he feels great.
And my doctor, he even said, I get the way I'm going, and he says maybe in the next year or so I might even be off the medications the way it's going, and that's my goal, is to get off his medications and stay on hers. So that's my goal, because that stuff isn't good for you, what the doctor prescribes.
It's very important to identify and to treat the cause of health problems, and that's an analogy that I give to my patients is if your car's check engine light is on, the point isn't to cut the wire that's connected to the check engine light, but to actually open the hood and to go inside and look at the engine. And what one problem might be that leads to the car's light being on in the engine might be completely different than another car. So the point is to look beyond symptoms, to look at the root of the problem, and to identify that.
This program is being brought to you in part by a grant from the American Association of Naturopathic Physicians. For a referral to a naturopathic physician in your area, go to www.naturopathic.org.
To learn more about the naturopathic approach to the treatment and prevention of cardiovascular disease and diabetes, we talked with Dr. Martin Milner. He's professor of cardiology at National College of Naturopathic Medicine in Portland, Oregon.
You know, it's interesting that the main causes of chronic disease, whether it's heart disease or diabetes, are things that really doctors don't even give to patients. Patients give it to themselves. Diet, exercise, stress management, mental attitude. The research is loaded with showing us that chronic disease is more lifestyle driven than anything else. And what's extraordinary is the medical system doesn't really train doctors to function as educators and health coaches like they need to, because if chronic disease is first and foremost diet and lifestyle mediated, then the role of a doctor really has to change dramatically and become more of an educator, the role of a health coach, as well as the role of a diagnostician. Naturopathic medicine is stellar in their training of us in that regard. So whether you have heart disease or diabetes, most patients are overweight. Most patients need to make significant changes in diet and exercise. If you were to ask a large number of people with diabetes and heart disease if they're under a lot of chronic stress and do they manage their stress well, they would probably say, I need help in that regard. Mental attitude's been studied for the last 30 years related to the evolution of heart disease, and it's a very big component as well. The conventional medical model for treating heart disease and diabetes is drugs first. The naturopathic model is health education, disease prevention, and optimizing health as much as possible. It's kind of interesting. One of the things I've learned over the years as a naturopathic doctor is if you take people with chronic disease and you encourage them to build health and wellness, it treats their disease at the same time. So not only can you improve people's diet, exercise, stress management, and mental attitude, but in the doing of it, you're helping to reverse and unravel some of their chronic disease. We as naturopathic doctors support our patients in optimizing their diet, and we also help them sort out whether any of the drugs they're taking are contributing to nutrient depletion. In this way, we collaborate with medical doctors. We may have a patient on a statin drug or a diuretic to help lower blood pressure. The statin drug in some cases can deplete coenzyme Q10. The diuretics can deplete minerals. So we'll look carefully at all of their drugs that they're taking to make sure there aren't any drug-induced nutrient deficiencies. What's very fascinating is all of the building blocks and cofactors in the chemistry of the human body are vitamins, minerals, amino acids, essential fatty acids. They're not drugs. There are hormones and enzymes, but the bottom line is the chemical soup that our body uses to fix itself is diet and nutrition, not prescription drugs. So ideally, if we start with optimizing diet and nutrition and using the building blocks from our food chain to restore our biochemistry to optimal, we'll avoid prescription drugs, and if we can avoid prescription drugs, especially the more risky synthetic ones, and recover our health with diet and nutrition, we're balancing our biochemistry.
Thank you for joining us for this American Health Journal special report, Discoveries in Alternative Medicine. For more information, call 800-303-3200 or go to thedoctorshow.com. For Discoveries in Alternative Medicine, I'm Roger Cooper.
This program is brought to you in part through a grant from the American Association of Naturopathic Physicians, representing naturopathic doctors, physicians who listen.
If you would like to order a tape or a DVD of today's American Health Journal, please call us at 1-800-303-3200.